Hi everyone, let's talk about Linezolid. Linezolid is available in two forms, tablet forms and infusion forms. So first of all, let's talk about what is Linezolid. So Linezolid is an antibiotic that is used to treat certain infections like bacteria infections. And most of you know antibiotics are of two types, bacteriostatic and bactericidal. So bacteriostatic refers to the drugs that stop the growth of bacteria. And the bactericidals are the drugs that directly kill the bacteria and clean the infection. Linezolid is a bacteriostatic against most susceptible organisms, but it displays bactericidal effect against some strains of pneumococci and Clostridium perfringens bacteria. And next, let's talk about uses of this Linezolid. So, as everyone knows, antibiotics are used in infection like bacteria infections. So this is mostly used in skin and soft tissue infections and pneumonia and some drug resistant infections like vancomycin resistant infection and MRSA, methicillin resistant staphylococcus aureus infection. So this is the antibiotic that is used for treating the infection as well as this is used for drug resistant persons also. And now let's talk about contraindications of these drugs. So first contraindication is hypersensitivity. So if anyone is hypersensitive with this drug, should avoid this drug because this can cause allergy in his body. And the second contraindication is serotonergic drugs. Anyone who is taking serotonergic medication should avoid this medication because the serotonergic medications like antidepressant and migraine medications can lead to serotonergic syndrome. So he should avoid this medication with those medications. And now let's talk about the doses of these drugs. So as we all know, the dose of any drug depends on the infection and the age and condition of the patient. And in common way, this can be taken orally or IV. So common dose of this drug is 600 mg orally or IV BD, means twice a day, that can be prescribed by the physician. But remember one thing, don't take any medication by your own. Always consult with your doctor before taking any drugs because any drugs can be show some side effects and harmful effects that may be serious to our health. So stop taking any drug before asking to a physician. And if we talk about side effects of this drug, so some common side effects like nausea, vomiting, diarrhea, headache and insomnia may be seen. But some serious side effects like thrombocytopenia, it means decrease in the count of platelets, and anemia means RBC quantity is low. So that can be a serious side effect that may be seen in the patient. And now let's talk about preventions of this disease. So first of all, we should inform the doctor about our existing medical condition like allergies with the drugs or if you are taking any other drug therapies. And stop use alcohol before taking these drugs. And in liver disease, high blood pressure and serotonin syndrome patient, this drug should be used with caution. Means it may be harmful, but if prescribed by the physician, take the as recommended dose and the duration that is suggested by the physician. Complete the full course of Linezolid even if you feel better in a short term. Because if you stop this drug taking after feeling some better, this can develop some resistance to this medication. And the most important point is to remember that is, if you experience any side effect of this drug like rashes, itching, swelling or dizziness, inform your doctor and seek medical help immediately. Don't wait to get better spontaneously, so immediately go to medical facilities. So this is the full detail about Linezolid antibiotic that may be prescribed by the physician to you and your family members. So if you find this video knowledgeable, like and subscribe this video and share as well as with your friends and families. Thank you.